All right. Good morning, everyone. I'm so excited to have you on our Mastermind call with Dr. Karol Poczatek. And as you read in the email from her bio, she's from Honduras. And Karol has been a great friend of mine, and I've worked with her and her husband and some of the other doctors for several years now. And Karol, I just think you're awesome. And so I asked Karol to share with us this morning about incorporating Hispanics into the practice, how to take good care of them, what their needs are, what they like. She really has done a great job. I remember the first time we talked, Karol, at the leadership course, and you shared your vision about the Hispanics and how you had such a passion for taking care of them. So I'm going to turn it over to you and get you to share with us. And we are recording this morning for the first time. We're going to try this. And so
has joined.
We're going to record the call this morning. I'm going to give it to Karol to take away and share with us your knowledge, Karol, about Hispanics in the practice. I think it's a great opportunity for many practices.
Thank you, Paula, for the introduction, and thank you for the opportunity to speak this morning.
You're welcome.
Good morning, everyone.
Has joined.
Good morning. Thank you for calling in. I know it's early, isn't it?
Yeah.
I know that planning for an early phone call is not an easy task, so I'm very thankful for the opportunity that you all have given me to share my story and my experience with the Hispanic patient population. I'm mostly excited and I'm very curious to learn what experiences and questions you all have regarding Hispanics as dental patients. As I planned for this call, I figured that the best way to give you ideas on how to attract Hispanic as patients, meet their needs, and successfully have a recall program where patients will return to you year after year is to share with you how I started my dental practice catered mainly to Hispanics. We first opened our doors in September 2010. So this month is our 7th-year anniversary.
That's right.
My team, I know, yeah. My team, my husband, Ted, who's also a dentist, his business partners, and I have learned a tremendous amount on how to do business with this patient population over the years. So how did it all start? My junior year in dental school, I was the only Hispanic, Spanish-speaking student in clinic. So, of course, most all Hispanic patients were assigned to me, or I was always called to translate for other students. Prior to my experience in clinic in 2008, I was under the impression that Birmingham, Alabama lacked a significant number of Hispanics to consider catering specifically to that population. But by my senior year, it was very evident that the population had grown and the need to treat these patients was there. So I decided to take a leap of faith. When I decided to take on the journey, I knew there were 3 well-known myths regarding Hispanics I had to prove wrong. So the first one is the belief that Hispanics don't care about their teeth. The second is that Hispanics don't have money, much less to spend on their teeth. And the third is that Hispanics are migrants, meaning they don't remain in the same city for long, so they move from city to city and they don't establish themselves in one place. So it would be very difficult to establish a practice if that was true. In 2010, I'd heard these 3 things over and over again from both my colleagues, dental colleagues, and from even my Hispanic family and friends. All I could do is say then was, well, we're just going to have to see. So very early on in my journey, I developed a very large and clear vision regarding what I wanted to do with Hispanic patients. I wanted access to dentistry to be affordable. I wanted the focus to be on education. and for ultimately to grow my practice to patients other than just Hispanics. So this is where you may want to start taking some notes, guys.
I'm already taking notes.
Take some notes. First, we had to find the right location. So you always hear about location.
Mm-hmm.
I was fortunate to have the help of Ted and his partners to be able to start a practice fresh out of dental school. We found a dental office that has not been operational for 2 years, right in the middle of a part of town heavily populated by Hispanics. It was accessible from Interstate 65, which gave easy access to patients from all over the state. It was a great opportunity, an affordable purchase. It was already even plumbed and furnished, and it just presented a fabulous location. Now, I do realize that some of you may already have an established practice and that you're probably not looking at moving. But if we have some time later on, I'll share with you how I moved my practice that had a ratio of 20 to 80 American to Hispanic. And in this new location where we are right now, the new ratio is 80 to 20 American to Hispanic patient population. So there are ways to increase your Hispanic population in your current location. It's easy if you understand how to market to the population and how to integrate it to your current patient base. So we had to place. Next, what we had to get the word out. Birmingham has been very fortunate to have a reputable Hispanic newspaper. Latino News celebrated its 20th year anniversary last month. It's a well-read circulation all over the state of Alabama and south of Tennessee. The first week we ran the ad, phone calls poured in, and patients began making appointments. If you're in an area heavily dense with Hispanic, chances are that there's a Spanish newspaper, TV, radio, and many other marketing tools to reach out to the community. We needed the right team. Depending on the volume of patients to be seen, at least one team member that's bilingual, perfectly fluent in English and Spanish is needed. And Paula brought this to my attention, guys, that Title III, Part 36 of the Americans with Disabilities Act prohibits discrimination against individuals with disabilities by places of public accommodation. So if you have a Hispanic patient in your office, you must provide for a translator if a patient doesn't have one. The ADA provides those services and assistance, and I think, Paula, you have some information that you can share later, right?
Yes, I have that pulled up. Mm-hmm.
So also check with your professional liability provider. The ones I've dealt with require that the translator understand dental terms, but does not need to have a certificate as a professional translator. So determine your commitment and volume. For low volume, you need one person to answer the phone and translate in clinic. For high volume, you need a front, an assistant, and hygiene to be bilingual. We started small. We one bilingual team member and one office manager. In 2010, there were no individuals that were both bilingual and had any experience in the dental field. So I've had to train all of my bilingual team members. For over 5 years, it was impossible to find a dental hygienist that spoke Spanish. I had to send one of our assistants to hygiene school. And now in 2017, we have a full bilingual team that includes the front desk, assistant, and hygienist. So I can't stress this enough. If you want a significant increase in your Hispanic patient population, at least one team member must be fluent in both English and Spanish, even if you speak Spanish yourself. Mm-hmm. And their English has to be good as well, because you want to make sure that there's no loss in translation when and then interpretation goes on.
Mm-hmm.
So why?
Carol, can I ask you a question there?
Yes.
One thing I've come across that's been helpful is the phone. If they reach the voicemail, some people have put like their message in English and then recorded it in Spanish as well. Is that something you did?
Yes.
Okay.
Yeah, that's what we do. It's always in both languages.
Okay.
And I currently have two lines. One that we use for our Spanish marketing, and
Okay.
a person that answers that line always answers in Spanish.
Oh, I see.
So there's no, when that phone line rings, it's going to be a Spanish-speaking individual, so they immediately just answer in Spanish.
Got it. That makes sense.
So the patient doesn't have to ask for somebody that speaks Spanish.
Okay. That's a good idea.
Okay, so why do Hispanic patients need us? Why should we see them? I haven't done extensive reading on this, but if you just do a quick search on Wikipedia, you'll find, and I quote, that the demographic of Hispanics and Latino Americans depict a population that is second largest ethnic group in the United States. 52 million people, or 16.7% of the national population. Of them, 27 million are American citizens. I had a pediatric dentist faculty in dental school. His name is Dr. Stephen Mitchell. He had a very clear vision regarding the treatment of children by general dentists. Dr. Mitchell wanted dental students to have plenty of exposure and experience in dental treatment of children. He believed that there were too many children and not enough pediatric dentists. He believed that general dentists could treat most cases in their office. This is exactly how I feel about Hispanic patients. There's too many for one single Spanish-speaking dentist to see all of them. So my goal is to provide other dentists with tools that will ease the fear of treating this type of patient.
You're exactly right about that, Carol. And I think it's a very good thing to provide access and make the Hispanics feel comfortable in your practice, no matter where you are. Because you're right, there's such a huge part of the population, we're going to encounter them and we need to know what to do.
Yeah, and I have come to find out that many don't seek treatment just because they don't know where or how, or they just don't feel comfortable when they when they present themselves to either a medical facility or a dental facility. So, but to better provide treatment to Hispanics, I think we need to just learn the culture. One of the main things that I try to emphasize with all of my dentists in my practice is to understand that trust is a crucial and plays a very significant role in the establishing a relationship with a Hispanic patient. So trust is a crucial element in every patient and doctor relationship, but it's most significant when it comes to treating Hispanic patients. Laws and regulations in most Latin American countries do not protect the individual rights of individuals. So a lot of personal and business transactions are done with a handshake and in good faith. And most Hispanics have had an experience in their lives where they've made a transaction but end up losing significant money, or they were taken advantage of, or there was no clear understanding of the transaction to begin with. The lack of trust is a major component in accepting treatment. Most specifically in regards to cost and price of treatment. Always give the patient a printed treatment plan and stick to the prices presented to the patient. Print a new treatment plan for any new changes to the plan, and present and include possible treatment that may be needed. For example, if a tooth has 80% chance of needing endo, then go ahead and present the price for the root canal. The patient prefers to get an estimate of everything that could possibly happen than to have to come up with extra money, not plan an unforeseen expense later. And I just explained to the patient, this is, you may or may not have this particular expense, and then I'll highlight it, and I'll say, once we get past this, we'll move on to some other procedures on your treatment plan. Pace the treatment as to not create unforeseen expenses. For instance, if you crown a tooth and you think you may need endo, then wait some time before starting new treatment, just to alleviate any unforeseen expense. So if the patient were to need a root canal on the tooth, they can go ahead and address the cost and expense of that treatment, and then you can continue with any other crown and bridge or operative that the patient may need. The Hispanic community is very close, and commonly they reach out to one another for help. Word of mouth will be your friend or your enemy. Winning the trust of a few at first will in turn win you the trust of many patients. So trust and
I think you're so right about the treatment plan, Karol. And really, that's basically what we should do for everybody. If you ask me, I think a lot of people come to the dentist with lack of trust. It's one of the silent objections. They don't always say they don't trust yet, but I believe it is more prevalent with the Hispanic for sure. They're on guard. But really, it's just common courtesy to give people a treatment plan and a list. I had a doctor tell me the other day he went in for something. This is a dentist. He's one of my clients. He went in for some treatment at a medical office, got to the front, and they said it was $2,000. No one had ever asked him or anything about finances. He was shocked when he got to the front. So I think it's just good practice for everybody, but yes, even more so with Hispanics. You're right.
I know I've used a lot of your tools, Paula, and every time you ask me about what works with a Hispanic, you're like, you should do that for every patient. I said, yeah, it works. I'm very, very strict when it comes to them, even with my doctors that help in clinic. If there was a unforeseen treatment, like we're doing crown on number 18 and 19 needs a DO, and DO wasn't treatment plan, we stopped, we informed the patient. I end up doing, they actually do pay for the procedure, even if it wasn't presented at first, but I give them the opportunity to make the payments on that particular procedure in payment plans. And I'll say, we did not know when we first presented your plan. We know that you did not bring this money. You're not prepared. How much time do you need? And they pay for it. So I don't have to write it off. I don't have to, I just give them more time in that particular scenario.
That's great. I see a lot of accounts receivables go sky high because we do same-day treatment, but we don't make a financial arrangement for it, so it sits in our aging report.
Yeah. And that, you spoke about financial arrangements, and that's the next thing I wanted to talk about. I always get the question of, even from our patients, like, do we have layaway plans, or do we, do procedures and then have the patients pay later.
Mm-hmm.
Now, with the Hispanic population, getting things on credit is very common in the culture, meaning like, can I go ahead and purchase this and pay you later? Can I go ahead and get this treatment and pay you later?
Mm-hmm.
So I had to fight that from the very, very beginning and just educate my patients and say, once I do this treatment, you may have an emergency in your family, and then you're not going to be able to make payments to me, so I don't want to cost you any unnecessary expenses that you can't afford. So I kind of explained to them that it really is a benefit to them because they don't want to have incur a cost that maybe they won't be able to afford if they have an emergency in their family or any other type of emergency. So at first, most Hispanics, they did think that I was going to do treatment and then they will pay me later. So we got past that really early on. I tell all my patients that payment is due the day the procedure is completed or at the time of the service. Mm-hmm. I break down a treatment plan in multiple visits if necessary, but I never do one filling at a time. The minimum is 2, but most definitely we encourage quadrant dentistry as for any other patient. I do spend some time with the patient to try to understand their budget, and then we sequence the treatment according to their budget. So any procedures that may require multiple steps, we can break them down in multiple payments, like a partial dentures, 3-unit bridges after extractions, that there might be a waiting period between steps. We go ahead and break it in payments, but we have a signed financial agreement in place with the dates of their appointments and the amount that they have to bring on each appointment. So if the payment is not made by that date, we push the appointment to another date. So that kind of could, I don't want any of my patients to come to delivery and they have like a huge balance that they can't afford, and they're we kind of just help them through the process.
Right.
We require 75% on payments on crown and bridge before we even send the case to the lab. Mm. So, but we do tell patients that the case only takes 2 or 3 weeks. So within the month that they get the procedure done, they have to be able to pay for the full procedure. Mm. So and we have many patients that have completed their treatment slowly. Some may do it right away. They take 1 or 2 months. Others may take a year. But the conversation that I have with them is, you've probably had this condition for 5 or more years. What is 1 year? That if we have to wait 1 more year, then we'll do it that way. And I just point out what we need to start with first because it's an emergency, and we'll tackle those procedures first and then pace ourselves with the rest. In terms of insurance, I do discourage my patients to purchase individual insurance. I do tell them that if their employment offers and helps with insurance, to go ahead and take advantage of that. But I have found that a lot of individual insurances are just very expensive and they don't provide coverage, and then patients end up having a 1 year waiting period, and most of my Hispanic patients don't even understand what they're purchasing. So we've created a membership program that we offer to all of our patients, Hispanic or American, and that allows them to get discounts on procedures and help towards their recall appointments. Mm-hmm. So if the patient doesn't have insurance, what I like personally is to just have one set fee for your recall appointments. Ours is $128, I think, right now. It doesn't matter what the patient gets done at that appointment; they will pay a flat fee.
Mm-hmm.
So, one appointment, it may just be your perio evaluation with your perio maintenance, and the doctor doesn't have to do that check. But then on the next appointment, you may get a doctor check with X-rays and your perio maintenance. That will be $128 as well. We kind of look at the price of the patient, but what the patient will spend over the year, and we've come with an average per visit. Because of the language, the more that you can simplify, the better.
Mm-hmm.
Like, it removes any confusion, because the patient will say, well, now why am I paying this? What am I getting? In order to not have to explain, we just came up with a flat fee, and just instead of focusing our time in explaining what the patient's paying for, we invest our time in educating the patient, more in the visit and the appointment regarding their dental health.
That's a great idea, Carol. I really like that, and it fits right in with the membership program of, the flat fee a month, and I love what you're doing with the make it a benefit to them about paying. What you said a few minutes ago about, you may incur a family emergency, and we don't want you to have this bill hanging over your head. That is such a good thing to say to them. And we just know psychologically people don't like you when they owe you money. And they avoid coming back because they know they have a balance, and then their future care is compromised. And so I think that's a great way to share with them, and really any patient for that matter. But good advice on the recare appointment here, the flat fee, and just wrap it all in. Good idea.
Once the patient sees the treatment plan and they see that the treatment can't be broken down into steps and visits, and that they only have to save up for one visit at a time, it just kind of breaks the expense. Most of the time I don't even give them a total. I just trash the page that prints the total, and we just tell them, focus a visit at a time.
Yeah.
It makes the whole process more doable when you break it.
That's a great idea. Well, isn't that what we do when we buy a car or house? They never tell us what we're really paying.
Yeah. Monthly payment.
We just focus on the monthly payment. No, I think that's a great idea to just help them focus on your next visit. This is what it's going to be.
I have some more notes. Saturdays, I just realized I didn't make a lot of notes on Saturdays, but Saturdays is huge. When working with Hispanic patients, they don't like to miss work. Some of them just think that they will lose their job if they're asking for too much time off, or if they may not have paid vacation, so if they don't go to work, they don't get paid. And Saturdays has worked as a big day. Like, they don't mind waiting if they have to wait 2 or 3 hours, but they prefer that over having to miss work during the week. So as we grew, though, we found out that more and more people have flexible jobs. So it's not it has not become where you just have to treat everybody on Saturdays. But it is a really good option to have. And you're not going to see where you open on Saturdays and patients don't show up. They want to be treated on Saturdays, so the rate of patients that will come into their appointment, they won't break their appointment, is not a big issue. If something comes up, they'll call and say they have to work. But for the most part, they're very respectful, and they know that it's a very popular day, and they don't want to miss their appointments, so they make a good effort to go to their appointments.
That's a good point. That was a question I had, Karol, too, of the cancellation rate of the Hispanic population. I know a lot of practices that see Medicaid say their cancellation rate is 30% for those patients. But what you're saying is the Hispanics, they really do respect that time, and they will show up. Is that what you're saying?
Yes. We've learned through the years. I mean, we do have a cancellation fee, a $50 for a 40, if you don't give us 48 hours notice. Mm-hmm. We also do, especially for Saturdays, prepayment, and we give a 5% discount. Mm-hmm. If the appointment is paid a week in advance, then the patient gets a 5% discount on their treatment.
Okay.
That gives us the money in advance, and we know that patient will, the patient knows we have their money. They'll come to their appointment. Very early on, we did have issues with cancellation, especially during the week. Mm-hmm. But I think as we build a more a committed patient pool, they do respect that. Just like going to your medical appointment, you have an appointment you have to attend. So I don't see it as being as big of an issue as it was when we first started.
Okay.
And just reminders. It's a lot. So we use, Paula, your call program. When to call to remind a patient. And I don't remember how it goes right now, but we do follow it.
Yeah, the 1-2-1-2, like a month out,
yes.
1 month out, 2 weeks out, then 1 week out, and then 2 days before, and then some people are even doing the 1 day before, and an hour before, or something like that, because most people are using the text and emailing. One thing I hear is, they have cell phones that are the paid cell phones and we can't get in touch with them, or they move those myths you were talking about. Are they responsive to your appointment reminders?
They are. There's you have the two type of patients, adult patients that come during the week and Saturdays. I think they typically have a cell phone number that's more dedicated. Like, it's not the ones that you pay.
Okay.
For the Medicaid patients on Fridays, and I don't know if Skylar's still on the call, if he can chime in, but the patients that we have already established, I mean, they've been coming to see Dr. Michelle for over 4 years now. They just know that they can't get this service anywhere else, so they know that if they miss, they're not going to get called back, or they're not going to get an appointment. Mm-hmm. So there is the factor of the kids that are in school. Mm-hmm. They tend to be the ones to cancel, but we do get phone calls for the cancellation. So we don't just have people not show up, so we can plan ahead. Mm-hmm. one thing that I've learned over the 7 years is that, and I did not know this either. Like, I'll ask my patients, like, how long have you lived in Birmingham? How long have you lived in the United States? And a lot of them say they've been here 15 plus years.
Wow.
And that just, as a Hispanic myself, I thought, I thought that it was like a recent event. I mean, now that this population has grown tremendously in the last 10 years, and it's not true. They have been, and many of us have lived in the same town for that many years. And they'll say, I've been in Montevallo for 20 years. I have 10 acres over there. So there is more than half of them have already been in this country for a long time. They have jobs, businesses, but for one reason or another, they kind of remain to themselves until lately, especially to Alabama. There's a newer migration to the state. To the state, a lot of them are like family members of individuals that have already been established here. So I don't see that movement of individuals, just being here for a few years and then moving to another state. I just really don't see that.
Okay. That's good to know, Karol. We interviewed some people. They're working on 2 houses on our street, and we called them to come over and look at some things for us. And we wanted to know, they were Hispanic and doing some great work. And we said, well, how long have you been here? Back in this year, we had hail damage, and they're like, oh, yeah, we remember that. And well, how long have you been here? They said, we've been here 20 years. So I was surprised by that myself. That's been my experience up here in the area where we live in Tennessee. So very good. That's good to know.
Yeah, I have just come to learn that in the last 5 years, and it's almost like everybody was, for any reason, just leaving in the shadows. Just maybe the language, kind of, they decided to keep to themselves,
That's probably part of it. You'll see areas where, they kind of live together, and there'll be churches. And I have a client who really wanted to reach out to Hispanics and brought in an Hispanic assistant. And she goes to a church, Hispanic church, and he's just had a flood of people coming in because of her, that she's really gotten the word out. And he doesn't speak Spanish, but she does. And it's a small practice, and it's really worked well for them.
Yeah, once you bring somebody in that is that knows a lot of people in that community, you're like, where is everybody?
Exactly.
I asked one of my patients once, I said, where have you been that I haven't seen you? And he said, I'm sorry, doctor, that I haven't come to see you before. I said, no, I meant I haven't seen you around in Birmingham since you've been here for 20 years. It was cute.
Yeah.
I do have some notes on actual type of treatment that we do on these patients. Do you want me to
Sure.
share that, or
I wanted you to mention what you did with the forms. You had all of your patient forms put in Spanish. I think that's important for people to know, right?
Yes. We have we duplicated the set that we have in English, and they look exactly the same except they're, in Spanish.
Mm-hmm.
So the patients get a complete package with the, HIPAA form that they have to sign and a medical history, and their the information that we need to get them in the system, and their insurance information, and their financial responsibility. All of that is translated in Spanish.
Mm-hmm.
We have Tyler, our hygienist that mainly sees Hispanics. He has videos that he shows on their new patient appointment
Mm-hmm.
regarding perio, for instance, or how to brush teeth properly. As much as you can provide on their own language, it really does help with making them feel comfortable,
Mm-hmm.
feeling okay, accept treatment.
Mm-hmm.
And they're just, what we've found is that by speaking their language, you kind of empower them, and they feel that, they understand and they're able to make decisions about their treatment. And that makes them just, makes them want to complete their treatment.
Right.
And it's not, another thing is that a lot of his patients speak English, actually, but for some reason, when it comes to their medical and dental care,
Mm-hmm.
they would prefer to talk in their own native language.
Huh.
My mother's a perfect example. Her English is perfectly fine, but she will always try to find medical care, somebody that speaks Spanish, and I have to encourage her and say, your English is perfectly fine. You need to look for the person that will give you the best treatment, or that you have a good relationship with. Don't worry about the language, but they all will say that they just prefer to speak Spanish when it comes to discussing
Mm-hmm.
medical.
Right. Right. That makes sense. I mean, I guess maybe they think when it's something serious like this and very important, they want to make sure they're not missing anything. I don't know.
Yeah.
Um,
What's on our side is, meaning for us dentists, is that in Latin America you don't have assistants, you don't have hygienists. So the first thing that we have to do is explain to the patient who they all are seeing, because in one appointment they could see the front desk for their financial arrangements. They'll see the assistants for X-ray, then they'll see the hygienist for their recalls, and then the doctor. They'll see the doctor as well. So sometimes they get confused on who the doctor is, but they're which it is good to have your team, like have the patient trust the team that you have, because that way you're not having to spend time going over things in Spanish. So it does help in that sense that to have other team members involved. And but I always do make the point, or make the effort to spend the time with them, because I've had some patients telling that they've been to other practices and they don't know who the dentist is. So I know that there are some locations here in town where they take advantage of the fact that they don't know how the system, how that they let the hygienist act like they're the dentist.
Yeah.
And the patient always see the dentist. So I don't
Right.
don't know.
Yeah. Okay. That's a good point, Carol. I'm glad you brought that up. That's something I did not know, that they don't have assistants or hygienists in Latin America. So they're wondering, who are all these people? Good part of the culture to understand. So I have a question. I know you have some things about treatment, but you mentioned, are you going to talk about how to get them to come back for recare?
The main thing that has worked, that's part of the main thing that has worked with us is education.
Okay.
80% of the Hispanic patients have periodontal disease.
Oh.
And that's for multiple reasons. Some of them have never seen a dentist in their life. Others might have come from very small towns in their countries where they never had a toothbrush until they were able to purchase one themselves as adults.
Mm-hmm.
So we see it even in young patients as early as in the 20s. I've had patients in their 30s that we had to do full mouth extractions and place them dentures. So it's a really it's very high in this population. So we educate about periodontal disease, and every time they come for every appointment, we just emphasize the 3 to 4 month recall. We tell them what's going to happen. For the first year, we're very strict. We tell the patient we're going to monitor for a year. We'll see how the pockets are going to heal. And then after a year, we might determine whether the patient will have to be referred or continue with us. Now, there's some, severe cases that we may go ahead and refer out right away from the first appointment. Mm-hmm. But I've always get the question of are they okay with the price? Are they okay having to come every 3 months? And it's almost like we explain periodontal disease. It's like a disease compared to heart disease, diabetes, high blood pressure, and we don't make it like we don't say we're here to just clean your teeth. Like, this is bacteria, and we show the video. So the patient does take it very seriously after we go through the education process. We even provide antibiotic application, like tetracycline antibiotic, and that's out of pocket. Insurance doesn't help with that. It's $150, and most patients get it every other appointment. And my friends ask me, like, how do you sell perio treatment? The first periodontal appointment could range anywhere from $500 to $1,000. So we don't. If a patient goes through it, we don't have problems presenting that and getting the patient to do that treatment. I mean, if you think about it, a crown is $1,000. So if a person is willing to spend $1,000 on a crown, why won't they spend $1,000 for the health of their gums? And I just tell the patient that the gums is the foundation of their teeth. If it's not healthy, they'll end up losing their teeth. Now, they probably do, most of them know a friend or a family member that they know that this has happened to, like they've lost teeth early on, so they have that reference, and they don't want that to happen to them. So in any given household, there's probably one or two individuals that just waited too long and lost all their teeth, and so they don't, ended up in dentures, so the patient will say, I don't want that to happen to me.
Great motivator.
So that, and we go ahead and make their appointments, and then we'll do the reminders, and then just encourage to continue. Right. If they don't, we say if we don't see you for a few appointments, or if we don't see you for a year, we have to start all over again. So the expense that you're incurring right now, you'll have to have it again. But if you keep coming, then the cost is less per visit, and you have healthy gums.
Nice. So, that's great. You have some really good verbal skills, Karol, and you build a lot of value. And these are, like I keep saying, these are things we need to do with all of our patients. And it builds trust when they see what we're doing, and then educate them, and then the progress, and find out what they want, what their goals are. So this is really, really good. Okay, we have a few minutes left. You said you wanted to talk about specific treatment?
I have a few notes about like the patient medical history. What you will see in Hispanic patients is mainly like high blood pressure and diabetes. You're not going to have a long list of medications. Patients do not like to take medicate. So I don't see like mental illnesses, sleeping disorders, anxiety problems. None of that is very rare. Like the medication list is on average none to maybe 2 at the most. Their high blood pressure, their diabetes. And I do have had patients that have high blood pressure, diabetes, and periodontal disease together, and we've worked on, the education of the link between the three, and they have successfully controlled all three, by weight, diet, medication, and coming to their recall programs at the not missing their interval, and just seeing how that has helped the patient treatment.
Wow, so you're saying it's been, the perio treatments has really helped maintain their blood pressure, their diabetes, heart disease? Yes. Yes. So you're seeing that play out?
With conjunction with antibiotic, like these particular patients, we will be more strict about the tetracycline antibiotic, and we recommend it every appointment. Now, at least for the first year, and then after the first year, we'll do it every other appointment. And we've seen where patients come in with tooth mobility, to where we stabilize gum tissue, nice pink, no bleeding, and of course the patient's also doing their part for with the diet and exercise and control the diabetes and high blood pressure. But it's almost like textbook what you learn in dental school. Like if a patient is doing what you recommend, both by the medical doctors and the dentist, you see all their numbers drop. Their periodontal probes drop, the bleeding drop, their HbA1c drop is very very textbook.
Wow, that's good. You're just the hero for them, and this is again something for the regular population that everyone, all walks of life, need to know, and you're just doing a tremendous job taking care of these folks and letting them know what benefit this is to their health. Are they excited when they see that they're getting so much better? I mean, do they care that they have high blood pressure and all that?
Oh, they do. They're I always make a point to say, I'm so proud of you. This is just, really, this is the things that we learn in dental school that we can put in practice. And so they're very excited. And they're active participants in the process. I mean, they know that if they do what we recommend, that it's going to work.
That's great.
So,
that's awesome.
They're very easy patients, and the treatment for them, most lesions are like virgin lesions, so it's just the dentistry it's not complicated. You're not going to have large amalgams that have margins below the gum line. Most lesions are virgin lesions, or they might have like a small filling that you have to replace, or a tooth that you have to crown. Periodontal disease is big, and I wouldn't be intimidated to present the treatment plan that you think the patient needs.
Yeah.
With the cost associated with it. You just have to focus more on the education of it, and the patient will find a way to pay for that treatment. A lot of partials, because of periodontal disease, because of maybe back in their home country, instead of getting like a endo, treating a tooth with a root canal, the patient might have chosen to have the tooth extracted. So I do see a lot of missing teeth, and partials are a big component of their treatment. And dentures. Like I said, we've done dentures on patients as young as like 35 years old. So it's because of the periodontal disease, I staged the denture very much what like we learn in dental school, which is you do a immediate denture, then you let the patient heal, and then you do a permanent prosthesis. And I quote both, and the reason is because of the periodontal disease, it is very difficult to get an accurate bite on teeth that have extruded.
Yeah.
I explain all this to the patient, and we just do like a more economical denture at first, and then we move to, we revisit after 6 months to a year and just do something more permanent. But
yeah,
that is
wow.
Pretty.
This is awesome, Karol. You've shared so many good tips here, and just given us some great education into the Hispanic culture, and the practices that I have that see a lot of Hispanics have done very well with them. They turn out to be, like you said, committed, great patients if we can communicate with them and educate, and when they have seen family members and friends already losing teeth, and then they see someone who's doing well. It's a great motivator for them. I'm sure they're very, very grateful and thankful for you and for all you've done for them and the community. So I really appreciate you sharing with us. And
Thank you.
Any last word of closing you'd like to say? Last word of advice?
No, if anybody, you're welcome to share my email with everybody. Paula, they might come up with questions later. I'll be more than happy to answer them. You
want to share what that is, Karol? Some people on the recording may not know me as it gets out there, but what's your email?
Okay. My email address is Poczatek, that's Poczzatek @gmail.com. And my cell phone number is 205-585-0272. So if anybody has any questions, I'll be very happy to answer and help in any way that I can.
Wonderful. Thank you so much. I really appreciate you taking the time to share with us today, and looking forward to how we can help more practices incorporate Hispanics and treat them well. All right. Thank you. Thanks, everybody.
Have a good day.
Bye.
Thank you.